Welcome back to Inside Access, where we explore new endodontic products together. I'm your host, Dr. Brett Gilbert. I'm so excited to bring you a great line of products from a company called Vista Apex. So Vista Apex continues to provide products that really give great value and provide good assistance for the type of needs that we have, especially when performing endodontic procedures. So one of the products we'll be describing is going to be the Impact Air. This is a surgical high-speed handpiece that has the head at a 45-degree angle to really facilitate visibility and is very, very useful. This is what I use in my surgical procedures. They also have a burr kit of surgical burrs. So all surgical length, all really designed well for the type of needs we have. I always find it convenient to have these burr kits, which are autoclavable right here in the packaging. The next product we'll discuss is the Visco tip. So this is going to be a material savings tip. So many of the tips that we use that dispense cement or sealer or calcium hydroxide, they require a lot of material to go up into the hub, which is lost, it's wasted. These are designed to truly minimize this, and their studies show up to 87% waste reduction with these Visco MST tips. The next product we're going to be discussing is a new line of tips called the Voyager line. Now, Voyager is unique in that it has a very nice dual port exit point at the end of the tip. It has a silicone stopper. They come in a variety of different gauges, meaning that you can have a larger volume or a smaller volume dispensing at a time. They come with silicone stoppers to really facilitate measurement and precise placement, and they also come in a variety of lengths. So we'll go over each of these. The last products we'll discuss are the irrigation solutions. This is going to be a 6% sodium hypochlorite. Again, FDA approved, proprietary. They have an expiration date. You can trust what's in here. The Chlor Extra, which is the 6% sodium hypochlorite with surfactant or surface modifier. Also the 2-in-1 smear off. So this is an EDTA chlorhexidine as well with some surface modifiers, and the EDTA. I've covered these solutions in a prior episode, but what's new is also this new Lure Lock dispensing cap. So this allows you to very easily dispense the solution cleanly, precisely, and allows your team to do it very, very nicely for you. Okay, so the first product we're going to examine is going to be the Impact Air 45. This is going to be a surgical high-speed handpiece, and then some of the accoutrements that come with it, including the lubricant, the cleaning and maintenance kit, and a great surgical burr kit. So let's take a look inside. Again, as you'll see, this is going to have the 45-degree angled head. This can come in a 4-hole option or also a 5-hole option, which includes the fiber optic light. They also have a 2-hole option, and they also have one that's a quick disconnect with or without the fiber optic light. And so you can see that the packaging does come with a little cap remover, so you're able to maintain and take care of this unit as well. So this is going to be the Impact Air 45-degree handpiece for surgical application. Okay, and then lastly for the Impact Air set, the surgical burr kit. And so this is going to be a great burr kit that you'd be able to use. Obviously, surgical burrs require a bit more length, and that's going to give us the opportunity to be able to really utilize them in a way where we can visualize everything very well and take great care of our patients. Okay, so let's take a closer look at the Impact Air 45. Again, the Impact Air has been manufactured in the US for more than 40 years. It's just the uniqueness is the 45-degree angled head, which just gives better access and visibility. We can see that clinically as we're using this for apical microsurgery. You can see how it's just much easier to see. It gives great clearance for that. So in the Impact Air surgical burr kit, you can see you have a number 4. Again, these are all surgical length burrs. So very clear there, the length of it allows for that better access and reach. So you have the 4, the 6 round burr. You then have a 701, and again, 701 gives you a little more of a flat cutting head surface, especially for apical microsurgery. The 702, just a slightly different shape here. You can kind of see that, a little bit thicker. Gives you a little bit more of a robust cutting surface there, and so you can kind of see the difference there. And then lastly, comparing it to the 1701, and again, being able to see just a little bit of a difference in the cutting surface and the ability. Okay, so this is going to be the Impact Air 45 cleaning and maintenance kit. So it does come with some spindle cleaners. It comes with a sample of lubricant here, but you can also get a larger bottle of lubricant for use over time. It does have another head cap wrench like was in the packaging for the actual handpiece. It has a black fluorosilicone O-ring. It also does have a black Viton O-ring as well as a few Teflon washers. So this is the ability to maintain the unit long term. Of course, with consistent use over time, we just have to make sure that we're taking good care of these equipment pieces so that they work well and are reliable for us. Okay, the next product is the Visco tips with material saving technology. And the idea is that you utilize these with some of the more viscous materials like sealer, calcium hydroxide, and you're able to actually reduce waste by 87%. And it's based upon the design here and the ability that these tips don't really pull the material inside. They allow almost a straight line release effect so it doesn't waste the material. You have two options here. You have the 22 millimeter unique polymer option, and this is going to be trimmable. So you can use a scissor to trim this if necessary. You can see the flexibility, and it's really a very useful tip. And then you also have the new stainless steel options, both in 17 and 22 millimeters. Both are 25 gauge. Now what's unique is that the hub is very malleable and has a very extra thick wall. So no matter how you bend it, it won't matter because it will not restrict the flow of the material. So the extra thick wall was designed for this purpose, giving you tremendous flexibility with how you place material inside of the tooth. So Visco tips with material saving technology, and we'll get a little more into this showing you clinically how they work. Okay, so let's take a closer look at these Visco tips. These are the material savings tips. Again, 87% waste reduction. You can see with the unique polymer, it's really quite flexible. I've been using these for many, many years. You have quite a bit of flexibility in how you can bend it and how you can turn it in order to facilitate it. Once you place it onto the sealer, which is what these will be primarily used for, you can kind of get a sense, you kind of get a little window where you can see the sealer start to come out. And then ultimately you can see kind of pinpoint placement with that. So that's going to be the classic Visco tip, the material savings tip. And then now, they've introduced the stainless steel version. Now this is very special in the fact that this hub is meant to be anti-restrictive. So in essence, this 25 gauge is going to be able to be bent and really be able to move so that you don't have viscous materials getting caught. So it gives a tremendous amount of flexibility in how you want to bend it to get it in. And you can see clinically how having that allows you to really place it very, very nicely. So again, fits onto any type of sealer that you might want to use. I've chosen here this bioactive endo sealer, the Regen. And again, it comes out very pinpoint placement. You can really control it. And because of the stainless steel, it gives you a little more feeling and a little less opportunity for the tip to sort of constrict as you're placing it down into the canal. Okay, the next product we're going to take a look at the packaging is going to be the Voyager tips. So these come in a 27 gauge, 29 gauge, 30 gauge, and 31 gauge tip, each one in a 17 millimeter or a 27 millimeter length. You can see that each is included with a silicone stopper, and this is very helpful to measure where you are within the canal space. What's unique about these is the dual port dispensing system, which creates a safer, more reliable way to really be able to distribute solutions. So we'll take a closer look at these in action. Okay, and here's going to be our Voyager tip. So you have the 27, the 29, the 30, and the 31 gauge. Important to note that the smaller the number, the gauge, the larger the volume. Let's take a good look underneath the scope here and kind of really see what this dual port system looks like. So once we get up into high magnification, it becomes really clear that you can see here that you have the one slot underneath and then you have the other slot on top. And so as it dispenses, it's going to come through both of those. Let's demonstrate that. Okay, so we've talked about this dual port design for the Voyager tips. And so when I go ahead and push just slightly, you can see how the solution bubbles and it just comes out and dispenses out of the two dispensing tips. And you can see that it's not shooting out the end, and that's the key. So again, this is going to be the 27 gauge, so a little higher volume. Okay, and then with the 29 gauge, just a little softer volume because of the smaller volume opening there. And again, here with the 30 gauge, so again, just a little softer volume than with the prior gauges. And again, with the 31 gauge, just a softer volume, smaller volume through this lumen. And lastly, I want to just review the products that are irrigation technologies. The sodium hypochlorite 6%, the Chlor Extra, which is 6% with surface modifiers and wetting agents, aka surfactants. Smear Off 2-in-1, again, EDTA based formula with chlorhexidine as well as some surface modifiers or surfactants. And then the 17% EDTA solution. I've reviewed this in a prior episode of Inside Access, but what's cool now is this new Lure Lock dispensing cap. Okay, let's take a look at this new Lure Lock dispensing cap for the sodium hypochlorite or any of the irrigation solutions. So again, very simply take any syringe with their Lure Lock end, and we're gonna go ahead and just tighten it on there. And then basically, you're just going to give it a little withdrawal here, and you'll see the solution fill in there just beautifully. Very easy to do chair side. Again, you can draw out the appropriate volume for the procedure that you're going to be doing. You then just simply unscrew it. So once you have it filled, you can just take any dispensing or irrigating tip. This is going to be a Voyager tip, and just attach it, and you're ready to go. So in this episode, we were able to cover the Impact Air 45-degree surgical high-speed handpiece, along with the surgical burr kit that is accompanying it. We've talked about the Visco MST tips, saving material, the valuable material that we're spending our money on, and being able to make sure that we're not wasting it. We talked about the new Voyager line of dispensing tips for solution, dual-ported, the ability to measure effectively with a number of different variety of options and sizes and lengths. And then lastly, we talked about the Endodontic Solutions line. We talked about the Chlor Extra, the sodium hypochlorite, the Smear Off. We also talked about the EDTA with the Lure Lock dispensing cap. Thank you for joining me and learning more about this great product line from Vista Apex. I have used all of these products and vetted them in my own clinical practice, and I give them my seal of approval, meaning that for any dentist that is performing endodontic procedures, these are viable, great options for your endodontic armamentarium. I hope you enjoyed this video. If so, please like it and subscribe to my channel. Also, leave any comments or questions below. I would love to hear from you. I would love to interact with you. And if you have any products that you'd like me to review, please let me know. Leave a comment and I'll get back to you. So thank you for watching the video and have an awesome day.